What's up, beautiful people? Another day, another study. One of the things I'm really excited about in AI-enabled healthcare of the future is just-in-time medicine. And what I mean by that is we've already seen that you can integrate wearables very easily into your clinical protocols and into your EHR. We do so at Nimbus, and we're working with some things there. But that just-in-time medicine allows for that wearable data, what's happening in the patient's life before they may even realize it, to be analyzed by AI, and then recommendations can go to the patient and the physician. We're now starting to see studies using wearables and looking at preventative data. So I love it. Let's get into the study. This study was looking at major depressive disorder, a common thing that we treat in primary care. It affects nearly 5% of the worldwide population, and unfortunately, up to 60% of individuals will relapse, meaning have another episode of MDD within 5 years. And we know that sleep and circadian rhythm disturbances are associated with lower remission rates, increase in suicidal ideation, and increased rates of relapse. And this study used Actigraphy, which is research-based accelerometers. They're better than what you see as far as the wearables that are available for consumers. And this was to assess sleep and circadian trajectories in individuals who relapsed and those who did not. And they used clinical assessment rather than self-reported symptomology. And these people were tracked for up to 2 years. And relapse was defined as a certain increase in scoring criteria, hospitalization for depression, emergent suicidal ideation, or medication change due to worsening depression. So at baseline, lower sleep regularity index, which is a marker of consistency of sleep-wake patterns over time, the relative amplitude of activity, or RA, is the difference between the most active and least active periods, and sleep efficiency. So when these were low, all of these were associated with an increased risk of relapse. And then higher wake after sleep onset time, that's the time you're awake after initially falling asleep, that was associated with a 77% increased risk of relapse. And then higher nighttime activity was associated with an 86% increased risk of relapse. And in the time-dependent model, the RA and then something called CPD, composite phase deviation, it's a measure of sleep phase variability. Both of those were associated with increased risk of relapse, so a low RA and a high CPD. So really interesting study. It was a small study. It was observational. There were some statistical limitations due to the amount of people in the study. They weren't able to correct for some of the other variables that could impact this, like lifestyle variables. But I'm encouraged by what I'm seeing in this area, looking at what data can we glean from these types of devices and how can we use this to predict either disease occurrence, disease worsening, or relapses like this in such a case. So I'm sure we're going to see more and more research in this area as we fine tune this and we are able to provide just-in-time medicine to our patients.